you. I just wanted to ask a question around why we are seeing disproportionate deaths in BAME communities. Does the panel agree that this is likely to be about more than just biology, and that structural and socioeconomic inequalities are a major part of it? And if so, how will this be addressed in any lockdown exit plan?
Thank you, Sarah. It's a really important point, and I think increasingly as we get different data sets coming through. So I think there's a publication shortly from the Obstetrics Surveillance Unit, for example, where there are potentially some signals, but I'm going to call them signals at the moment because one of the problems that we do have is where we have done some, or not we, but different academics, different research groups have have looked at data that they have. By the time you start taking out elements of particularly underlying disease prevalence, so things like we know chronic cardiac disease, for example, is a key contributor to poor outcomes from COVID. The same applies to diabetes. So when you start taking out the risk element from those conditions, which are frequently more prevalent in some Black and minority ethnic groups, it gets a very, very complex picture. When, as you've just highlighted, you then add in the complexity of the fact that perhaps cultural differences in the way people are living, or perhaps the fact that different groups will be more likely to be living or in socioeconomically deprived areas in some instances, it is a really, really complex picture. So I think what we're seeing are signals in some areas, but not all data sets are, when looked at in detail, are demonstrating very specific Black and minority ethnic disparities. So an example that I would give you is that there is a COVID a data set, COSIM, which is based on the hospital admissions, and I think this is where the signals were first picked up. That has been looked at in some detail and has not been able currently, I think, to detect a significant difference, but different signals are coming from different data sets. And I think the answer to this will come from the Public Health England work, which is looking not only at those characteristics, those variables which may be of importance alongside ethnicity, so the disease conditions as well, but is absolutely recognising that people will live in their own communities, and that socioeconomic element is also being considered. I also know that the Public Health England team working on that recognise how important it is to link with the minority groups while the work is ongoing, because I think actually people understanding the process and what that might mean for their community, whatever comes out at the other end, is equally important.